Hi, my name is James Rogers. I'm part of our Nexus therapy team. And today we're going to be talking about anxiety disorders. Now, if there's like a specific anxiety that you kind of want to learn about, you can go ahead and skip forward. This is a longer and in-depth look at anxiety, and we're going to be looking at a couple of different anxiety disorders. So again, is going to be a longer video, as you can tell wherever you're watching this, because it's going to be an in-depth look into anxiety disorders as a whole, and not just only on one specific one or just anxiety in itself. So again, you can skip ahead and look at the different anxiety disorders if you'd like, or watch the whole thing, get a great in-depth view. With that said, let's go ahead and begin. And we're going to begin today with talking about what anxiety is as kind of in its place. What is anxiety? Right there is it's an anticipation of a future threat. That is how I would and many others in the therapy realm describe and define anxiety. It's anticipation of a threat or perceived threat, even. Let's say an object or an animal, or maybe even a situation has given us stress in the past, and so therefore because we think it may cause the same anxiety or same um, maybe distress within us, that causes anxiety to kind of rise in us because of the perceive or anticipation of the future threat. Now, all anxieties have a similar common theme, as it says below, is they all have different objects or situations that cause the anxiety. That's kind of the main theme, because they're all different. They all have different maybe causes, but they all have a cause. And the first one we're going to go over with is separation anxiety disorder. I know that's such a sad photo, but I think it explains this disorder very, very well. Many of us have children who maybe are afraid of going to childcare. We've experienced separation anxiety. It takes a little excessive and more extreme measures that causes it to be diagnosed as a disorder. Because separation anxiety, like I had it as a kid, but it wasn't extreme. It's just, afraid of going to childcare. That's kind of a mild sense, but it goes to extreme lengths, which we'll talk about. But again, it's just being the stress or even just stress of being separated from their parents, or just primary attachment. So it could be a parent or guardian. We see this all the time, again, in childcare. Excessive worry. The prevalence is mainly children under 12. As you can see, we don't really see this a whole lot in middle school to high school age, though there is some. So don't, as you see 1.6, we also do see this in adults as well. So don't think if you have a child, they'll just simply grow out of it. They could, but you can also go see a therapist, which I highly, highly recommend, just to talk with, get some maybe help or pointers on working with a child who has anxiety or separation anxiety disorder. Now, here's what we call the DSM-5 diagnostic. The DSM is what we call the Bible of therapy. It helps us it's a reference for us of the different diagnoses. Now, if you don't take this as, yes, my child has this, so please don't diagnose your family member or maybe someone or a child please do not diagnose without a therapist or a psychologist in the room or with you as you're talking with them. But here's what the diagnostic criteria is. I'm not going to read every single one, but it's developmentally inappropriate and excessive fear or anxiety concerning separation from those to whom the individual is attached. And the evidence of that is by three of the following list. There's also going to be more. So you can go through that. You can stop right here and go ahead and read through some of those. I don't want to read through all of them. We have a lot to go over, but you can pause the video and look through them. Here are there's 8 at the top, repeated complaints of physical symptoms. It has to last at least 4 weeks in children and adolescents, typically between 6 months or more in adults. So again, do not diagnose someone, but this is just probably to more be aware of some potential things that are going on. Risk factors: environmental and genetics and psychological are the 3 big ones, right? Environment, so maybe there has been a loss in the family. Maybe they just moved. and the child is a little scared because they don't know what's going on. They're afraid of the unknown, right? Or maybe a disaster happened recently, so they're a little afraid of leaving their primary attachment or caregiver, as we like to say. And so environment can definitely play a huge piece into this. So be aware of that. Genetics, this could definitely be a genetic thing, and passed down from family members and stuff like that. And again, it's a psychological thing. Maybe they've seen someone, or they had something going on, which caused them to kind of be afraid of leaving their primary attachment, which they're, again, please consult a therapist or psychologist. Now, the treatment for this is something that we call CBT, which is cognitive behavioral therapy. There's a few ways. One, CBT is used to kind of manage that anxiety. It talks about your thinking, your feeling, and your behaviors, and how those three interact with each other for this anxiety. Different ways is play therapy for much kind of younger children. We even do this with adolescents and some adults, but maybe it's more prevalent in children's therapy. So go see a therapist. You can see us at Nexus, or see one of your county's mental health resources. You can go on their website and find that out. We have some resources at the end of this video. Specific phobias. So we all know phobias. I think we all kind of have some phobias, whether it's heights, spiders, different animals, or even just situations such as skydiving, seeing blood. I know I used to be afraid of seeing blood, so I kind of under that one. But whatever it is, I think we all kind of have a tendency for this. We can all get over this, as we know. But again, this is anxiety caused by a situation or an object. So let's say people are very scared of spiders. Now, there's some extreme cases where they can't go near spiders. They can't even touch spiders. They don't even want to look at one. Some people are afraid of sharks. I know someone who literally, if they saw a picture, they would scream and run. And this, again, not a bad thing. It's just something that they did because they were so much fear of sharks. So whatever it is, we all have these kind of specific phobias. Here's kind of the prevalence in the United States and kind of around different countries. Females are more likely to have phobias than men. Even depending on the object or even situation, it depends. It really depends on that one. Phobias generally start around childhood. Just some fun facts to know is it generally starts around childhood, right? Like I know there's a lot of kids who are afraid of dogs because dogs attacked them as a child. And so they're kind of afraid of that dog attacking them again or having that situation occur. And so there's different therapies and treatments for that as well. But it can cause a lot of stress and anxiety. And even as you're an older adult, like adults are afraid of dogs because of that childhood experience. How often have we heard, oh, well, there's a situation when I was younger that caused me to be afraid of X, Y, or Z, whatever it is, right? We've all kind of been there. Again, the phobia can be developed from a variety of different experiencing yourself, seeing someone experience it is something. So hearing information can definitely cause it. Well, I heard that they did this and this happened, so now I'm anxious over this, which is 100% can happen for true. Risk and prognostic factors, temperament, just their neuroticism, their own temperament around certain things and different things, which is not a bad thing at all. Their environment, maybe their parents, kind of nature nurture type of thing, where maybe their parents were afraid of something or overprotective about something. Maybe there's some abuse, some traumatic experience. Genetics, it can play a huge bit into that as well. There's a theory that if you're this is a theory again, so this is not actually solid, but there is some situations where, because if the mother was scared of heights and had a situation while she was pregnant, that it can actually cause the child to be afraid of heights or certain situations because the fear spike levels while she was pregnant and pass it on to the child. That is a theory and has happened a few, but it depends on the situation. So don't think that's a direct cause all the time. Here we go. Agoraphobia. Now, agoraphobia, is when basically you would probably say them as extreme introverts. They like to stay at home. They like to be alone. And this is outside of, let's say, in 2020 when there was shutdown and lockdown. This is not just that, where it's a little bit harder to diagnose during that time when things were getting shut down and people were staying at home more. So don't think this is just because you stay at home, but it's an excessive, extreme version of just being on any situation, being around crowds, being around people, just wanting to stay at home, maybe excessive staying at home, not really leaving at all for maybe even very, very few things, which can definitely happen. And so that's kind of what agoraphobia is. Here's the prevalence. Just a few things. It's very, very mild, very small population, 1 to 2% within the United States. It's very, very strong. It could be hereditary, it could be situational, whatever it is. Whatever it is, it could be caused by your environment. Maybe again, something happened kind of similar to separation anxiety or specific phobias. There could be a situation that happened. Maybe your parents are afraid to go outside, so therefore you're afraid to go outside. Here's some kind of different, or here's some diagnostic criteria. Again, we're going to talk about in the next slide or two about how to differentiate this from just like, hey, I just don't want to go outside because of a lockdown maybe that happened in like 2020. Or, maybe there's a situation that they don't want to leave, whatever it is. Again, doesn't mean you have this. And again, consult a therapist or a psychologist as well. So these are different diagnoses. You can pause and read these for yourselves. The thing is that I feel like separates it, is the fear, anxiety, or avoidance is persistence, the letter F. Persistence typically lasts for 6 months or more. So it has to go for a long time, 6 months or more. It can't just be like a week or two. That could be very situational. But if it exceeds 6 months or more, now we're starting to kind of, looking at this a different way. And maybe, okay, this is agoraphobia, and there's specific ways to how to treat this. Here's some more differential diagnosis as well. Sorry. All right. So here's some things to remember when kind of with everything in general, but it's with agoraphobia is the duration has to be more, kind of the 3Ds to remember: duration, distress or disability. In differential diagnosis, again, this could be maybe substance abuse caused, so that's why they're staying indoors. Maybe another anxiety disorder. This could be OCD, PTSD, situational kind of phobias, maybe just panic disorder. So again, there could be different diagnoses. So don't think because, oh, my buddy or someone who kind of has something around this, that it's specifically this. Again, consult a professional before you make any diagnosis on anyone or tell anyone like, oh, you have this specific one. I do want to go back and talk about agoraphobia and some kind of even treatment with separation anxiety. Is what we call exposure therapy. Exposure therapy, basically, especially with phobias, is it gives small amount of either time or kind of exposure to the situation or object. For example, if someone had a fear of spiders, a great kind of exposure therapy would be to slowly give them opportunities or kind of put them into situations where a tarantula would be or a spider would be. For example, let's say the tarantula is in a cage, and the exposure therapy would be one, just to look at the cage at a far distance, like be super separated, and slowly maybe inching towards it, maybe slowly touching the spider with a brush or a long stick or something like that, like kind of continually to exposure, but it's at their own time. It's ease. Please consult a therapist or professional before you, if you don't try it at home. Consult a professional before you diagnose and try this. This is just giving you more information about what we do as therapists to kind of treat for these different anxieties. And so kind of continue on is anxiety, generalized anxiety disorder. Sorry for the cutoff. It's GAD or GAD. This is persistent and excessive and unreasonable worry. So this is just generalized anxiety. This is just, kind of anxiety disorder. And I love this picture by the Peanuts. It's my anxieties have anxieties. How often have we said that? I've felt that sometimes about being anxious and then going, oh my gosh, I got to stop being anxious. So then I start being anxious about a situation, right? But this is a continuum. Again, this is going to be the duration and just stress, and the type of situation as well. But just kind of waking up every single day about worry for a certain amount of times and about things that maybe we even shouldn't be worried about. Here's the prevalence as well, very low in adolescents and among adults, but it's starting to grow a little bit more and more common in females than in males. Okay, so this is what it is. At least 6 months or more is kind of excessive worry. So it has to be 6 months or more, occurring more days. So it can't just be like one day there, because that could be just situational. But on a number of days for 6 months, about a number of events or activities. So there's a lot that has to occur for this to be diagnosed. In adults, it has to have 3 or more of the following 6 situations. Children only generally has to have 1, but again, it has to last a long time. So let's make sure before you diagnose. But this just to give you some information about generalized anxiety disorder and kind of some our diagnostic criteria. Kind of the main causes of this is it's kind of unclear, but there's 2 thoughts: family genetics or circumstances, situation, abuse, disaster, loss. Again, it's a generalized anxiety over certain situations. So at the beginning, when we talked about anxiety and kind of what it is, we have to take that into a factor where it's the perceived thought or anticipation of anxiety or situation. So again, it could be family genetics. It could be something the family has where they had anxiety, so then they kind of pass it down. Family genetics or circumstances or situations can cause generalized anxiety. 2 forms, again, we're going to bring up CBT and medication as well, but I would suggest starting with talk or behavior therapy and then consulting a professional about medication. Now, substance-induced anxiety disorder. This is something that is, again, caused by anxiety caused by substance or medication. And before you diagnose this, again, please go see a professional. I need to state that more and more. Don't just diagnose, okay. But there are some medications or drugs or toxin that can cause anxiety. And this is just kind of some information about it. Prevalence, it's very, very rare, but it does happen. It has to happen within 12 months. So it can't just be like a small thing. Again, it has to last for a long time. Some treatment is a therapy in group therapy. There are some medications. Consult the doctor, please. Or you can go see a therapist for individual therapy. Social anxiety disorder. Now, this is, again, 2 different things from separation and agoraphobia. So we'll be talking about that as well. So what is it? It's an intense fear and anxious of social situations. So specific social situations is something that we need to look at. It's afraid of negatively or evaluated or judged. We all feel that at some level, I feel like, with every social outing. So again, this has to be more and the more extreme versions to be diagnosed. So here's some diagnosis. Marked fear or anxiety about one or more social situations in which the individual is exposed to possible scrutiny by others. This has to, in kids, it could be expressed by crying, tantrums, freezing, clinging, failing to speak. So there could be a lot of different kind of responses to the fear of social anxiety disorder. And so there's a little bit more. It has to be prevalent for 6 months or more. So remember, it has to be a long time over a variety of things. It has to be extreme. And it just continues last. You can sometimes even just see certain situations that they're afraid of and kind of look at that and go, okay, well, what are they afraid of? Maybe something caused that fear. And so they're afraid of it. So kind of look into that. Again, consult a therapist or professional. The next thing is panic disorders that we're going to be talking about. The DSM-5 says this is a recurrent unexpected panic attacks that include at least 4 of the following symptoms. I don't want to read all of them. You can read them. But I'll read the top 4, which is palpitation or heart pounding, sweating, trembling, or sensations of shortness of breath. This is over a long period of time. If you have a lot of these, then go consult a therapist, go see someone at Nexus or your county mental health supervisor. There needs to be at least one of the panic attacks has been followed by 1 month or more of the following, or both of the following, persistent concern or worry about additional panic attacks or their consequences, a significant maladaptive, unhealthy change of behavior related to the attacks. There is an example, my sister had panic attacks, and something that we had to do and walk through with a therapist, with a professional. She would get just kind of panicky around, it was kind of around dogs in certain situations, and so she would have extreme just panic attacks every time. There was some, again, it was diagnosed between, okay, is this a phobia, or panic attack, or both, and they had to consult and talk through and go through the DS, or not the DSM, but through the criteria and talk about with a professional. If this is some specifiers, if I have a panic attack, do I have a panic disorder? Nope. However, it's helpful to understand that the symptoms so that an individual or provider can identify what is going on. Didn't we already talk about this? We did, good memory. But since it's estimated that 11% of the population in the US experience them, let's refresh. Again, here's some signs of a panic attack, a little bit more, just little. And then here's some resources. And we'll end here. But some resources is the National Alliance on Mental Health. There's the .org. Alyssa, in Amador, if you're in Amador County, there's also one, or us at Nexus. Here is our location, our telephone number. If you'd want to seek some therapy or just maybe some coaching or anything like that, we'd love to come alongside you as best as we can. And thank you for watching. Again, you can reach us at Nexus Youth and Family Services. My name is James, and thanks for having us, or thanks for watching, and stay tuned for more informational videos.